COVID was a disaster in the sense, medical disaster, I would rather say, which impacted not only countries but the whole globe. So your chain of information, your chain of various sharings and partnerships and relationships were significantly affected at all levels. There was a sudden chill in the total work of the organization. Our staff could not move out. The ongoing projects were immediately stopped. We could not reach out to the community immediately. It took us a time to understand and assess as to how do we organize ourselves and impact in the sense that the health systems otherwise also in the rural areas were very, very weak, and they were absolutely unable to cope with these disasters. And it impacted resource transfers, it impacted approaching and reaching the community significantly. And there was a lack of mobilizing workers together to respond to that current situation. But gradually we overcome that. And we realized the value of having a strong network. First thing which did that, we approached the government and we got passes. And that is how we also encouraged our people to get in touch with local government and district administrations. First time that we started using the digital platform in such a huge manner. I mean, and with the people, with the community also being a part of that process. With community, with the partnerships, with the local leaders, the people of panchayat leaders of the community, our partners in the development sector, other stakeholders. We mobilized and we developed a chain. We completely decentralized and we provided resources all our colleagues to take appropriate decision in consultation with the partners. So the primary areas which we addressed at that time was providing cooked food wherever we had the ability to do so, providing direct ration. A large number of beneficiaries across the country, as well as also cash transfers in their bank. We provided masks and some basic medicine which is necessary. Even we were able to provide shelters locally to many of these migrant workers and working with the migrant workers, so enabling them to reach to their destination. In the second phase, we were better organized because an experience of the first phase was also very strong. In the second phase, the work was more focused on the livelihoods, creation of livelihood, as well as also these campaigns and health aspects. These awareness campaigns organized by the community, organized by the local youth leaders, so the acceptance was higher. In the beginning, there was a lot of vaccine hesitancy which was coming up. So that brought us a lot of new ways of working. Of course, digital transformation was one of the primary things, but we linked up with local hospitals, we linked up with primary health centers. Our youth workers were asked to get vaccinated first, and they themselves led the campaign. So that had a very good impact. And we roped in the local panchayat leadership, as well as the primary health centers, even private concerned private hospitals and private doctors also. But there were skilled workers we were able to manage from our sister organizations, those who are focusing on health. So IEC materials was very extensively produced and pictorial so that people can understand. Gram Sabha was initiated these discussions on that. In the second phase, a lot of support to the primary health centers, also the district health centers we provided. We provided them with thousands and thousands of oximeters and thermometers, digital thermometers, and then a large number of oxygen concentrators, oxygen cylinders. wherever we found that the primary health centers are not functioning well in our program area. So we organized our youth leadership and the community together, and with the primary health center and with the local medical infrastructure, we supported them with whatever was requested from them. In total, see, we had during this period worked about in 20 states and union territories and about covered 2,000 plus villages. About 8 lakh plus population we have covered up till now. The work is still going on. It's a long-term effort now because we feel very strongly that suddenly the medical emergencies also have taken up a center stage. We cannot only work in the framework of making people access resources and all, but how there is a better infrastructure, how investment in health increases. That is very, very important. I can only say that the role which the civil society has played is very, very critical role because in developing the overcoming the vaccine hesitancy, reaching the remotest area. So as the momentum gained, the civil society, as it is always capable of reaching the last person, the last mile, this time also they have reached. It establishes the need for very strong civil society in the country, not only in the country, but globally. And what we have always been trying and talking, that ownership of the local is very, very essential. A significant amount of leadership has been observed, not only amongst the civil society organizations, but also from women and men, youth. It is important to strengthen the civil society work. We all have to understand this, contribute collectively towards